Learn how the R-brush is used to manage peri-implantitis in real clinical cases. When implant surfaces are heavily contaminated due to peri-implantitis, the R-brush ensures precise cleaning and thorough decontamination. First, remove the prosthesis and abutment. Then connect the cover cap to the fixture to protect the implant platform during the cleaning process. Along the exposed implant surface, the R-brush rotates with a vertical reciprocating motion to effectively cleanse and transform rough areas into a smooth, machined surface. This case involves peri-implantitis in the number 25 implant, leading to vertical alveolar bone loss and inflammation. Treatment was planned using the R-brush to restore the implant surface. First, the flap was opened and all infected tissue was carefully removed to expose the implant surface. In this case, a cover screw was connected instead of a cover cap. The R-brush was connected to a 1-to-1 contra-angle handpiece and operated at 8,000 RPM with sufficient irrigation. The recommended speed range for optimal cleaning is 8,000 to 10,000 RPM. If the implant diameter feels narrower than the R-brush, move it side to side while applying vertical pressure. This technique ensures effective decontamination of the implant surface. It is essential to continue using the R-brush until all rough surfaces are completely removed. Be sure to check that the surface becomes smooth, shiny, and fully decontaminated before proceeding. Guided bone regeneration was performed to promote osseointegration on the new implant surface and prevent further bone loss. The procedure was then completed with suturing. With the R-brush, peri-implantitis was effectively treated, and the 1-year follow-up X-ray confirmed stable bone levels with no further bone loss.